Hello, and welcome to the Cervical Endometriosis podcast, where we will delve deep into experiences, challenges, and triumphs of those navigating a life with endometriosis. Join us as we share the stories of resilience, offer insights from experts, and foster a community of support for those affected by this often misunderstood condition. Whether you're newly diagnosed, a seasoned warrior, or seeking understanding, I hope this podcast is here to help empower you and uplift you on your journey. Tune in as we break the silence, shatter stigmas, and amplify the voices of the endometriosis community. Medical disclaimer: this podcast is not intended for the purpose of providing medical advice. All information, content, and material of this podcast is for informational purposes only and is not intended to serve as a substitute for the consultation, diagnosis, and/or medical treatment of a qualified physician or healthcare provider. Thank you so much for being here, and now on to the show. Hello, everyone, and welcome to this month's episode of the Cycle Podcast. I'd love to welcome Amanda to the show. How are you? Thank you so much for being here today.
Oh, I'm great. Thank you for having me. This is so exciting.
Oh, I'm looking forward to chatting with you and getting to know you better. But as I always like to start, before we get into the endo journey, why don't you tell us a little bit about yourself, anything and everything you want to share?
Yeah. So my name is Amanda. I am from Phoenix, Arizona. I have been navigating through endometriosis for 15 years now. I have 5 dogs right now. We have a bird that we were just talking about. And then, I work from home most of the time. I like to make TikToks about endo because it just brings more awareness and everything. And that's kind of a little about me.
Wow, 5 dogs. What kind of dogs?
I have a pit bull. We also have 2, we have 2 Dobermans, sorry. We have a mutt. She's like a little mixed dog. She's so sweet. And then we have a Great Dane that we just got.
Oh my goodness. How do they all get along? Do they all do they coexist well, or is there a little tension sometimes?
Sometimes there's tension, but that's okay because we have a couple of crates so we can just separate them and everything is all good. So,
you know what? This is totally off topic, but maybe not. I learned from one of my coworkers, he actually had a Doberman and it was a therapy dog. And I know that those dogs sometimes get a bad rap that they're mean or things like that. And so I was so shocked. He would take his dog to hospitals to visit people and things. And I was because they're really intelligent dogs, aren't they?
Yeah, that's what I've heard. They're so smart, and they're so sweet. Yeah, that's what I love about them.
Yeah, I know.
At least ours are.
Well, and Great Dane. Great Dane's like a horse.
Yeah, pretty much. That's it.
Oh my gosh. I love pets and animals, and I don't have any myself, but I do love living vicariously through everybody else. So thank you for sharing about that.
Of course.
All right. So Arizona too. How's the weather there right now for you all?
Oh my gosh, it's perfect right now. It's so perfect. I love it. It just got to be the most beautiful weather just probably a week ago. So
yeah, not too hot.
I love this time of year. Yeah, no, it's perfect. It's in the 70s right now. So I'll take it.
It's lovely. Heck yeah. I love it. I love it. Okay, well, let's talk about endo. And we were talking before the show, and you said it's been a really long journey. So what do you remember, if anything, at the beginning of that journey, or when you started to first feel something was off?
Yeah, so my timeline is super messy, like I told you, but that's like most endo journeys. I believe I was around 7 when I first started getting symptoms, and they were stomach aches. They were just stomach aches, and I couldn't go to school sometimes. I thought that it was maybe nerves or I had a sensitive stomach, but now looking back, I can't help but wonder if that was the start of everything. So,
I mean, crazy. I think it's great that you point that out, though, because you're not the first person that I've chatted with that have said that. And I actually remember being younger too, and just maybe being more sick than other people. I always had ear infections and just weird stomach, for sure, always stomach stuff, but just weird things that some of my friends didn't have.
Yes. Yeah. All the time.
Yeah.
It's
So
crazy. Think
what
about it.
happened after, like, you're having this? What happened after
Yeah.
that?
So when I was about 11, that's when I got my first period. And it was brutal. It sucked. It was horrible. Obviously, it's horrible when you're 11, but it was really bad. Pain was really ridiculous. It would last over a week sometimes. And it was a lot for an 11-year-old. And not to be like TMI, but it's like I would go through pads and go through clothes like it was nothing. And of course, it happened at school. So it's super
Of course.
embarrassing. Right.
And
Yeah.
especially at that age. I mean, what, 11?
Yeah.
You're like in fifth grade, I feel like, right?
Mm-hmm.
Fourth or
Yeah.
fifth
Something like
grade.
that. Yeah.
Yeah.
And I didn't understand what was going on.
And there's
So
no TMI, by the way, on this show. So let it all out.
fair enough. I love it. I love
Okay.
that.
So at that point, like, do you remember being like, this is kind of weird? I mean, you're 11, you don't know, but did it seem
Yeah.
like anything odd to you, or you thought this is just how it is?
I just thought that's how it was. Like, I would always keep a change of clothes at the nurse's station, or I'd have a jacket with me so I could tie it around my waist. But even with like all of that stuff happening, and now that I look back, it's like nobody took it seriously. And I was told I was being irresponsible because I needed to be more proactive about, just watching out for myself. And so I felt super dismissed and totally invalidated. So I just kind of kept quiet about everything. So
The
yeah, that
shame
was crazy.
that you must
Yeah.
have felt, and it wasn't your fault at all.
Yeah, for sure. Yes.
So
I eventually
sorry.
went to a doctor though when
Yeah.
I believe I was 12.
Okay.
The crazy thing is he said, "Oh yeah, she probably has endometriosis, but we don't need to worry about it right now until she goes to have kids." So we're like, "Okay." So, which is yeah. So I just shoved it in the back of my ADHD brain and moved on with
Yeah.
my life like it was nothing. They put me on the Depo-Provera shot and that helped a lot. But I was on it forever. So
Did
way
they
too
start that
long.
when you were 12?
Mm-hmm.
Wow.
Yep. Yep.
Wow.
It
And that
was,
helped.
yeah,
So
so
did
young.
you not have a cycle at all then, or did you not
Right.
bleed? Okay.
Mm-hmm. Yeah, I did not. And I was fine for a few years and stuff, but then into my late teens, early 20s, I started getting pain that was worse and worse. I was getting like more cramping, exhaustion, and then I started getting nauseated, which was a totally different new symptom for me.
Yeah.
So, yeah.
Right. And all of this is still happening. And that's why I know, obviously this is a full body disease, and we have to focus on that sometimes, because I think it gets lost in the mix of like everybody thinks it's a period disease, and it's not, because you still had all of these symptoms when you were on the shot that was suppressing your period.
Yeah. Yeah.
And
Basically.
what were you, so you're going through all that. How was, like, junior high, the rest of high school? Were you missing anything? Were you not feeling well? And did you correlate any of this? Because why would you? You didn't know.
I didn't know
Yeah.
anything. I was still sick and stuff. I still felt like I was sick. It was like this weird feeling of just, I don't know how to describe it, of just feeling sick, like your body is sick, but there's no way to really describe it. So,
Yeah, I call it the endo, like, flu. Like, it's almost like it's
yeah.
not the flu, but like your whole body aches, you feel nauseous, you feel a general sense of just unwell.
Yeah.
That's what I always used to call it. I'm like, oh, the endo flu is here. And that's basically what I would derive as, I'm not a doctor, but like a flare up.
Yeah. Yeah. I mean, that's perfect. That describes it perfectly.
Yeah.
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 But I remember being like 18 or 19 and I would go into work and I would talk to one of my coworkers, and she was like a big sister to me. So I would, vent to her and stuff. I would tell her almost daily. I was like, I'm still on the pill at this point. Like, I'm having cramps, but they're not cramps, and it's not my stomach either, but it kind of feels like that. It's just the weirdest thing. I couldn't describe it. And it just felt like the pain was so deep, and it was like screaming, but it's like nobody knew what was going on,
Right.
So,
Right.
yeah.
So what happened after that?
I I did every test imaginable, like the blood work, the ultrasounds. I even did a colonoscopy when I was 20, 21. Any tests that I could do, I did it. Every single time I was told everything looks normal. So they ended up diagnosing me with IBS, which is a very common thing with endo. And I call that irritable BS syndrome because I feel like it's an umbrella term where they don't know what's really happening with you.
Yeah.
They just want to put a label on it. So, yeah.
So you're going through all these tests. They're not finding anything. They say it's IBS. Then what happened?
I just kept pushing through, smiled, went to work as much as I could, and just told myself I was just being too sensitive or I'm being a wimp and I just need to like deal with it. So I ended up on the depot shot, being on the depot shot for a total of about 10 years, which is way too long. I will tell
Such
you,
a
way
young
too long.
age.
Yeah.
Such a young age to go on it.
Mm-hmm. But I didn't know any difference.
Of course.
Yeah.
I would have done it too. They never offered it to me, but same as you, birth control, birth control, birth control. Like it was just like, take it for your whole life.
It's like Tic Tacs. Like, here, have one.
Yeah.
So bad. I didn't think much of it until I went in for my routine well woman exam one year, and those results came back abnormal. So I had to go see an OBGYN to get a closer look at everything. And like you do with any new doctor, you give them all of your medical information. He did the exam, and because my well woman exam was abnormal, he took a cervical biopsy. During that visit, he realized I'd been on the depot shot for almost a decade. So I remember his eyes got so huge, and he's like, you need to stop this immediately. Like, you've been on it for way too long. You need to stop it. So I ended up switching over to the pill, but that, as we all know, is a lot of trial and error, trying to figure out one that's going to work with your body.
Yeah.
And then he asked if I had pain anywhere, like if I had anything else going on. And I kind of laughed and was like, yeah, my whole body hurts. Like, even my bones hurt, and my back hurts, like my stomach hurts, everything. So there I was, I'm like 20 years old, and I'm getting a bone density scan and fighting with insurance to get it covered because of the depot shot.
Right.
Yeah.
And how did that scan go?
It came back, and I had osteopenia, which is the early bone loss. Yeah, and that was from being on a depot shot. Yeah.
And you were 20 years old.
Yep.
Wow.
So, but once I got off of it, all my bone, everything started coming back, and it was fine. Yeah. Good. So
that's good.
But in the middle of all of that, I got my cervical biopsy back, and that came back positive for cervical cancer. So I was like, okay, not one thing, but now it's this. Yeah. So.
And this is when you were 20.
Mm-hmm. Yeah. So I ended up going to my OBGYN's office a couple days later, and he's the most awesome OBGYN. Like, he doesn't know everything about endo, but he's always been flat out honest with me about everything. And he's like, this is what's going on. These are your options. We can essentially do something about it or not do something about it. It's your choice. It's your body. You let me know what you want to do. So we moved forward with, it ended up being classified as stage 2. So we decided the best step was to burn away the cancer cells and then just see if the tissue grew back healthy or not. So we did that. It grew back healthy. I kept going every 3 to 6 months to get checked, and it was fine for a couple years and stuff. But I figured with that, all my pain was coming from those two things. That's what I thought. Sure. So I was like, all right, now I'm going to feel better.
Yeah.
Spoiler alert. Yeah, I didn't feel better.
Yeah. Were you, after you had that done, were you on the pill? Were you like, how you were taking the pill after that procedure?
Yeah, I was still taking the pill. I remember I was going back and forth between different ones because I ended up actually doing the NuvaRing, and that was like the best thing for me. But then at a certain point, I ended up wanting to switch over to an IUD because I was like, well, I'll pay this copay and be good for a few years and not have to worry about it. And I don't have to go pick up a prescription every month. So let's do it, So I did that, but I feel like some people deal with the IUD great. Other people like me do not deal with it great. So it just depends on your body.
I've heard both both
Yeah.
ways. Some people, right, do really well with it, but some people it's just like it doesn't want to be in there, and your body is reacting, and you're still going through all of this pain in this time too. When you had the cervical cancer diagnosis, did endo ever come up again? Was it were you thinking about it all? From obviously that was so long before when it was mentioned to you when you were still a child. I mean, you weren't even a
Yeah.
teenager yet. So that wasn't, this is, you have this procedure done, you're on the pill, you're going to go on the IUD, which sounds like you're going to tell us about, but you're still not feeling well.
Yeah. Yeah. No, I didn't remember endo. Like, I literally pushed it in the back of my head, like, cool,
Yeah.
I don't need to even think about this.
No,
Because
I would
that's
never
not a
have
thing
thought
right
about.
now.
And when you're 12, like, barely could remember what I learned at school, like it's just, you're still so young.
Yeah. Yeah. It didn't click. I had no
No.
idea.
Well, and it's not like, because it's not like it's out there and people know what it is. Like, it's not like you
Right.
would have, like, it's not a word. I remember when I first started, I was like, I've never heard this in my life. I don't know what it means. I don't know what it is.
Yeah.
So why
Yeah.
would you at 12 even like register that word,
Yeah. I forgot even about that appointment until after I was diagnosed. And I'm like, oh my God.
Yeah.
Oh, that
Yeah.
doctor. Like, could have done so much more at that
So
point. But
much.
yeah, of course, that was forever ago. So
Forever ago. Okay.
yeah.
So you go through this, get the IUD. Sounds like your body
Hmm.
did not want the IUD.
Yeah, so it did not like it. I kind of felt like it was in the wrong place, but every time they did a scan, they're like, no, it's in the right place. And I'm like, God, I could feel it though. It hurts. So I ended up getting a huge ovarian cyst. So I had to have emergency surgery to get it removed.
Yeah.
And when I woke up, my OBGYN is like, hey, I removed the cyst. Like, everything is great. You do have endometriosis, but I removed as much as I could. And so I'm like, oh, okay,
Right.
whatever. That's
Right.
cool. So I went
Right.
on. I was just like, whatever. And at the time, I had told my then boyfriend what happened at the appointment. And he's like, oh, do you know what that is? And I go, no. He goes, you need to look it up. And I was like, oh, okay. So I did, because
I have
I had no
chills
clue.
that he said
Yeah.
that.
Yeah. And so 2 months later, I ended up in the same exact pain that I was in before. I had another ovarian cyst, but it was even bigger.
Oh,
And it was the size of a grapefruit. So it was huge.
so painful.
I
I know.
remember too. Oh, so weird. Like, I remember I lay down on the floor and I could feel it, And then my boyfriend at the time, I'm like, let me see your hand. Put your hand there. Can you feel it? Like,
My
it's right there.
gosh. How
So
old are you at
crazy.
this point now?
Probably like 23, 24,
Yeah.
somewhere in
Yeah.
there.
Still young 20s.
Yeah. Yeah.
So then
So
you'd have another surgery.
I had another one, and he was like, and this is only a couple months later. It's not like years
Wow.
later or anything.
Wow. Yeah.
It was literally 2 months later, and he
Was
does
it
the
the same
surgery.
ovary?
Yes. Yeah. It's always been the left one. Always. Yeah.
The left is my bad one too.
Yeah, they're such jerks.
Yep.
Oh my gosh. So yeah, I went in and he removed it, and then he's like, yeah, I removed as much endo as I could again, but it didn't even look like I did anything 2 months ago.
Yeah.
Because it was, I didn't realize at the time he was just burning the surface of the disease with ablation, not removing the full disease. Yeah. So each ablation surgery made it worse. Yeah. And I felt like I could literally feel it growing, which was so weird. But I was just like, I know it's back. I could feel it. I know it. I had 3 of these surgeries in total within a year. So it was
the ablation surgery. And so for people listening, definitely go do your research on the difference, between ablation and excision. And I will say, after my first ablation, it was like 6 months later, I was so much worse. I was really struggling about 6 months after that surgery. So
it's hard because it aggravates it. It just pisses it off, and then
Yeah.
it grows. It's like it's mad that it got burned away, so now it's like, I'm gonna fight back, and it just
It's like
grows.
just more inflammation,
Yeah.
Yeah. Yeah.
And
Again,
then you're inflamed.
not medical
Right.
doctors here, but this is what our assumption is of living with this lived experience is what
Yeah.
I call it.
Yes.
Okay, so you have
Exactly.
3 of those. Oh my goodness. And what happens after that?
So I am like, all right, what the hell is going on? Because this is a lot happening in a year. I start digging. By this time, I had ended up taking out the IUD, and I am now on the NuvaRing again. So I'm feeling better because that just worked better for me. So I start doing more digging over time, and I discover excision surgery. I actually went on Facebook and was like, what is this disease? And then I find all the endo groups and I get added to them, and I'm like, oh my God, what's going on?
Information overload, right?
Yeah,
Like,
it's so much. It's so overwhelming.
it is. But
So
at that point too, with that very similar type scenario for me, like it was almost like a light bulb though went off, and I was like, oh my gosh, all this nausea, all this stomach issues, all these migraines. Like I was like, this is all related. Like my mind was blown because I was seeing so many different doctors in my 20s.
Yep. It's mind blowing, honestly, how crazy it is.
Yeah.
In 2014, I ended up having my first excision surgery with Dr. Michael Hibner in Phoenix. That literally changed my life. 100%. So I was so nervous about that surgery, but he's an amazing doctor. I really, really like him. He's amazing. He found endo everywhere, as expected. The front, the back of my pelvis, around my ovaries. I also had a cyst on my left ovary that had ruptured and was bleeding internally, which I had no idea my ovary had ruptured, or the cyst had ruptured. I had no idea. So, because of the other pain, it just
for sure, your pain tolerance is so high. Yeah.
Yeah. Basically, like my entire pelvis showed signs of the disease. And so that gave me finally like real answers after years of not knowing what was going on. He checked my tubes because I was just starting to try to get pregnant and they were clear. So right after surgery, I started fertility treatments. And then I realized so fast that fertility treatments are such a double-edged sword with us, at least for me. I don't know about everybody else, but for me, because it's like the hormones that are meant to help you conceive actually like feed into the endo and make it more aggressive and more painful. And I even thought I was going to have to stop working at that point because it was just hard to stand and hard to, get up and do anything. So yeah, it was rough.
I'm so sorry.
Thank you. What else was I going to say? Oh, so it was February 2016. So this is 2 years later. I had not gotten pregnant yet. And I figured I should have another excision surgery to give me a clean slate, so to speak, because I understood that this was not a disease that you could ever get rid of. There's no cure. It's there, So couple weeks before this surgery, I had an MRI and that looked totally normal. But as we know, imaging isn't always reliable. So
I'm glad you said that.
Yeah, it's not. Never.
It's not. Nope.
Even if it does show something, it doesn't show the full extent of the disease.
Yeah.
So
100%.
yeah. So I ended up going in for my 5th surgery. And I had the gut feeling like something wasn't right. Like there was something else going on. So I asked Dr. Hibner if he could take biopsies of my uterus while he was in there. And he said, yeah, he would do it. So surgery 5 was one of the most complex surgeries that I had ever had. He found endo again, front, back of my pelvis, around the ovaries. He removed my appendix because it looked like it was going to be affected by endo because there was so much around that area. So he just removed it. You don't need it. He also did nerve block injections, Botox injections to my pelvic floor. And my left ovary was attached to my left abdominal wall, which is crazy. It's so weird. Yeah, so weird. And side note, it is such a weird feeling to have your ovary stuck to your abdominal wall for so long and then suddenly have it removed. Because it's like, I kind of missed it being attached to it. It's the weirdest feeling.
I
was like,
totally
something's missing.
understand. Because you're so used to that, like almost
Yeah.
like pulling or heaviness. I don't know how to describe it, but yeah. And
Yeah.
then when it's not there, it's like, is something else wrong? Because you're so used to it.
Like, it's missing. Something's not there. Like, it really bugged me. It was making me really upset. Like, I kind of wish he just left it there. But,
Oh my
can't do
goodness.
that. So the next morning, Dr. Hibner came into my room, and which was weird because he had never, I mean, I had only had one other surgery with him, but he didn't come into my room after surgery after that one. So he comes in and he sits on my bed, at the edge of my bed, and he's like, he just says, I am so sorry. He goes, I did everything that I could do. I took 6 biopsies of your uterus and they all came back positive for adenomyosis. And I'm like, oh, like that's what I thought. So, so he said that my uterus was basically having nonstop contractions. Like he was like, it's kind of like you're pregnant and you're going through contractions to have a baby. Like that's why it was hurting so much. That's why you couldn't stand up straight sometimes. Like, and I was like, this is the most validating thing I've ever heard in my life. Like, this all makes sense finally. So yeah, but it was very upsetting too. So he told me I have a history of dilated cardiomyopathy, which is a heart disease. I was born with it. So he went into more detail about it because he had been talking to my cardiologist since I was trying to get pregnant. Like him, my cardiologist, my fertility doctor were all in communication, which is amazing because I know that does not happen for everybody at all.
So like that's so great.
Right. Yeah. It was, can't believe that happened. I feel so lucky that they all were on the same page about everything.
And like willing to work with each other, because sometimes there's some egos involved, and that's great because it was like they were all working to make the best outcomes for you.
Right. He did say because of that and because of my adenomyosis, he's like, carrying a pregnancy could be life threatening to you or the baby. And I was like, well, what do you mean? Like, I knew what that meant, but like, what do you mean? Yeah. And he's like, I think if you get pregnant, if you can even keep the baby because of the adenomyosis, I don't know if you'd survive the pregnancy because a lot of women get dilated or get cardiomyopathy when they're pregnant and you already have it. And I'm afraid that, you could be in the store walking and just fall over and die because of your heart. And I'm like, okay. So it was so soul crushing. And I was just like, okay, so what do we do?
Yeah.
I go, can you take me back and do a hysterectomy right now then? He's like, no, you need to actually think about it and you need to be okay with that choice. I don't want to do that unless you sit and think about it for a minute, which is huge too.
Yeah.
Obviously, you couldn't take me back anyway right away.
Right.
It was, very sweet.
Sounds like a very empathetic, good doctor, but I'm so sorry that unexpected. I'm sure that was not what you were expecting him to come in and say. How hard that must have been.
No, it was so crazy. It was just like, I can't believe you're saying this right now.
Yeah.
Like, how is this a thing? And, I look back and when you're a kid, how when you're little and you're like, oh, I want to be an astronaut or I want to be a doctor or I want to be this or that. When I was little, I was like, I want to be a mom. Like, that's all I want to be, all I care about. And I want to be a damn good mom. So this was like, oh, what the hell? Like, horrible news. Anyway, I'm not a very patient person. So the following Monday, I scheduled my hysterectomy because I'm like, it's like I have to choose between living or trying to have a baby. Like, that's literally what was on the table.
Oh, man,
so I scheduled that.
Sorry.
Thank you.
I'm so sorry.
It was so fast too. That's the thing, because I was literally doing fertility treatments up until a month before my hysterectomy because I still was doing it in like hopes that it would happen, so so I scheduled my hysterectomy. 2 months later, on the morning of my surgery, I still took a pregnancy test because you're like, even when everything is saying no, there's like that voice that you hope that it's like, oh, well, yeah, maybe this is it. And I figured if I was pregnant, then that's definitely meant to be, and I could cancel my surgery. But that wasn't what happened. And they obviously take a pregnancy test when you get there too, so make sure. But I woke up from that surgery, and for the first time in years, like I did not have that sick feeling, and that heaviness was gone, and it was crazy. Even when I was still all drugged up and stuff from the surgery, but I was like, oh, I feel better. This is crazy. I've never felt like this before at that point. So I know that was a huge thing.
All of that,
just gone.
Gone.
So, but I want to make sure people understand that a hysterectomy doesn't do anything for endo, especially if it's just a hysterectomy. So
it's
that's
not
a big thing.
It is not a cure for endometriosis. It's an old myth, and we do talk about it in the show a lot, but unfortunately some of those myths are still out there.
Yeah. Oh yeah. Yeah. That's a lot of them are. It baffles me.
Yeah.
How many of them. Yeah, but I felt really good. And for a while, I wasn't perfect, but I had my life back. I could go back to the gym because I hadn't been in the gym in years. And then in the summer of 2023, I started bleeding. Very weird. So, and I started tracking it. It wasn't a lot, but it was a little. So I started tracking it on my phone. Like, what is happening? Because I've gotten used to being like, all right, I need to write down my symptoms and the dates, the times, like how I was feeling. What did I do that day? What day of the week was it? Everything. So I started tracking it, and I realized that it was happening every few weeks for a few days at a time, like clockwork. And I was in pain again. I was exhausted. Like I felt like I was having my period again.
Yeah.
And so I called my OBGYN and I went in, and I'm like, I don't know what's going on. Can you do an exam? And he's like, yeah. So he did. And when I went in, of course, I wasn't bleeding, but but I asked him, I was like, could this be endo? And he goes, I don't think it's endo, but I don't know for sure. And he's like, I think it's cancer, but I don't know. So he was ordering all these tests. And so I got a referral to an excision specialist at St. Joe's at that point because Dr. Hibner had left and opened up his own private practice and was only cash pay.
Yeah.
So I went to St. Joe's. I saw this newer doctor, Dr. Afwape. She did a quick exam, like physical exam on me. I kid you not, like maybe a minute. And she gets up and she's like, okay, you have endo on the outside of your cuff. That's why you're bleeding. I was like, wow.
Goodness.
I was very impressed that she figured that out like that though.
Fast.
Yeah. So impressed. So I love her. She's amazing. I ended up having surgery with her, and I didn't know her very well yet. She did not have a lot of patience yet because she was brand spanking new. So I was like, I don't know what I'm getting myself into, but I'm going to do it and we'll figure it out, I guess. But I believe she did work under Hibner before she took his spot. So I had a little faith in it. Yeah. So scheduled my surgery. During my pre-op, I was like, hey, so what happens if you find endo on my diaphragm during surgery? And she was like, that is a very specific area. Why are you asking that? Like, do you think there's endo there? And I said, I thought that I might have had endo on my diaphragm before, but I wasn't really sure. I could have been mistaken. And she said that she didn't see it on my notes, but she'd go over it again. And if so, then she would reach out to me and let me know that there's a different game plan. She did say if she did suspect it, or if somebody does have it for sure, then she brings in a cardiothoracic surgeon to help her with that specific surgery because she's not comfortable because the diaphragm is a very delicate area. So, But I had an MRI done. Of course, it didn't show anything.
Right.
So
Right.
we had surgery. And I did have some symptoms, I will say, before surgery, but I thought it was from my heart because it was just getting harder to breathe. I was just getting tired easily. So there was really no other reason to think that I had it on my diaphragm. I woke up from that surgery, and the first thing my boyfriend says to me is he's like, they found endo on your diaphragm. And I'm like, oh my God, I knew it.
Did you have a chest tube in?
No, thank goodness. Oh my gosh. It's like we really know our bodies better than anybody else. And
Your
that's so
intuition.
important to remember with this disease. Like,
Yeah.
it's so important. She didn't touch it because she wasn't comfortable with it. She removed it from everywhere else. So I went in for my follow-up and she gave me the option. I feel so lucky with these doctors because they've all been like, all right, you choose what you want to do. Like, we don't have to do anything. And I know not everybody gets that option. But she said we can either leave it and just see what happens, or we can remove it if you want to go that route. And she said that if we wanted to remove it, we should wait a year so that my body can fully heal from the last surgery. So it gave me time to also think about it. But I decided to move forward with it because it was like part of me wanted to see if any endo grew back anywhere else also within that year to just see like how fast it was growing at that rate. And then also because I was like, well, I don't want the endo puncturing through the diaphragm going into my chest cavity onto my heart because my heart is already not great. So I just want to avoid that. And I mean, whatever anybody chooses to do is their own personal choice. Like, there's no right or wrong answer, honestly, with that.
And your intuition seems like it hasn't set you on the wrong path. It's always been right.
Crazy. Yeah. Especially with this. So, but I ended up having my endo surgery, the diaphragmatic endo excision surgery, in March of this year. And so she brought in a cardiothoracic surgeon and they removed it off the right side of my diaphragm. Nobody was sure if it had punctured through my chest cavity or not yet. So we were hoping not, but it had not, thankfully, but it was just on the other side of the diaphragm, like right by the heart. So I am so glad that they removed it and took it. Yeah. So, cause she said it did grow more since the last time that she saw it. So, that recovery, so that was surgery 8 for me. And that recovery was the hardest recovery I have ever had in my entire life. Yeah. So rough. I probably would have still gone through with the surgery, but I was not prepared at all for that.
For how tough it was. I've heard it's really, really challenging.
Yeah. I was coughing for days after that. And then it's like every time I cough, it would hurt. Oh my gosh. I couldn't laugh. Like, I was trying to think of all these ways that I could clear my throat without coughing.
But it was so hard.
Drink something.
Right. And you were healing in that spot and just, oh my goodness. So that was in March.
Yeah. I had to sleep on my back for weeks. And it took months before I can even like think about laying on my right side again. It was just like I just couldn't do it at all. And what really sucks about that recovery is I ended up getting bronchitis that next Tuesday. So I had surgery on Thursday. Tuesday I was in the hospital with bronchitis. I was like, oh my gosh.
So that was obviously it was so hard on your recovery.
Yeah, that was. My gosh. I was just like, really? What else is gonna happen?
What?
So
I mean, incredible, like that you went through all of that so close together too. It was like so many years that were just like in such a close proximity. So how are you feeling now?
Oh, I'm feeling a lot better. I don't have that pain on that side anymore. I mean, I feel pretty much normal again, so to speak. I still have pain, but it's not nearly as bad as it was before.
Yeah.
So it's yeah, I'm grateful I did that surgery before it spread any further, because since then I've read other stories where it has spread, and oh my gosh, I'm just like, I'm glad, because I can't imagine them doing that surgery and trying to remove it from your chest cavity, because then they have to go in another way usually to remove it
and I've
from
met
there.
some people who've had multiple lung collapses. I have a friend too that their lungs have collapsed from having endo there. So it's super scary.
Yeah, I was worried that would happen during surgery too, but I didn't wake up with a tube or anything in the chest. So grateful about that.
Yeah.
But
I mean,
yeah.
Still, you've been through so much and a lot. How, for people who are listening, like, how have you gotten through all of this? It's a lot, and it's heavy, and work and relationships. And how have you done it?
I don't know. You just have to
Day
keep
by
going.
day.
Like, literally,
one day at a
sometimes
time.
hour by hour.
Yeah.
Minute by minute sometimes. Yeah. It's a lot. It's a lot. And if you don't go through it, you don't understand it at all.
Yeah.
Like, you don't grasp what it is at all. So, but I mean, these surgeries, especially post-hysterectomy, has very much confirmed that it's not just in your pelvis. It like can invade your entire body. And I know I've had more surgeries than most people end up having, but I've learned how crucial education and advocacy are, because when I was first diagnosed, I was so lost, and there wasn't TikTok, there wasn't Instagram, like any of that stuff. And I felt like nobody was telling the full truth because they weren't. So
because they didn't know.
Grateful. Yeah, they didn't. Yeah. Nobody knew. Yeah.
Nobody knew.
I am so grateful though that we have all these platforms now, because then we can talk about it and people don't feel so alone, and then they know what questions to ask their doctor, and they can understand that, just because a doctor says that they do excision surgery, it doesn't mean that they're an excision specialist, or that they understand how to remove endo, or that they know all the forms of endo to look for. So there's little things, we have to really do our digging before we pick our surgeons, which is sad.
So true. It's so true. I mean, I had someone even locally that was like, yeah, I do excision. And then when I read the operative report, of course, years later, when I learned what that meant, nope, did not do excision at all. So I agree with you. I think the sharing of knowledge and the internet, whatever, social media, maybe not the internet, but social media has helped. I think it's really helped people be able to find each other and connect. And, it sounds like it's a place where you're pretty active in talking about things since your surgery. So you mentioned that you like to make TikTok videos. So are you on TikTok and Instagram talking about these things? Tell us about where you are.
So I started sharing my story online. I do share some of it on Facebook. I do share some of it on Instagram, but mostly it's on TikTok. So that people can just look for me and then just find all these videos and stuff. And I have a lot of I don't do as much on Instagram because I have so many of like my family and my personal friends, and I don't want to overwhelm them.
I get it.
All my endo stuff, like, hey, this is all I'm going to talk about. But, I wanted to start making videos somewhere so that I can help spread accurate awareness, not just awareness. So, and just even help one person feel less alone, or walk into a doctor's office with more information than I ever had. And so I just been doing that on TikTok, and I use any questions that I get and just make more videos. And there's like never ending content, I feel like, because there's always something out there. So
or something new developed, or that's incredible that you're willing to do that and get vulnerable and share what's going on with you and to help other people. So that's paying it forward, which is amazing. Well, is there anything that we didn't cover that you want to talk about, or tips, or anything that you want to share with everybody who's listening?
I think the only thing is just make sure you do your research before you commit to anything. Really do your research and talk to people who've actually lived through it, not just who have read a book.
Yeah.
So
Yeah.
do that for yourself.
Agree. Yeah. And really, you've been through so much, and it seems like you have such a shining star personality. And I think that that's incredible. And you're helping other people. And so thank you for coming on and sharing with us your journey with this horrible disease.
Yeah. Thank you for having me. This has been a lot of fun. I know it's not a great topic, but it is a lot of fun. So
It's nice to just talk through it and talk to people who understand, because sometimes it's hard in our daily lives. People, like you mentioned, Amanda, they just, unless you've been through it, it's really hard to understand. Really, really hard. And I'm sure there's, we all know that there's people in our lives that like love us and care about us and they want to, but to the level of probably how much I know I even still do behind closed doors, don't let on, is going on, is a daily occurrence.
yeah.
So
Exactly.
well, thank you so much for sharing, and thank you everyone for being here and listening to the show. Please rate us if you like this on Apple or Spotify, and we will link all of Amanda's TikTok, not Instagram, maybe, we'll see, whatever you want, in the show notes so everyone can find you.
Perfect. Thank you for having me. I
Thank
really
you so
appreciate
much.
it.
Thank you for being here, and thank you everyone for listening and supporting the show. It means so much.